It certainly takes a team to run a really busy service like this. So I have no financial disclosures. I'm going to be talking about, my topic is thinking differently about AI and the future of cardiovascular health. And just to start off, in the Mount Sinai Fuster Heart, we're very focused, particularly in the cath lab and everywhere. Everybody, you'll see today, everybody is very focused on safety, quality, patient experience. But what you're going to see is we're now talking about artificial intelligence. And there's a lot of fear out there. There's a lot of fear that we're going to replace nurses, we're going to replace NPs, we're going to replace physicians. It can't. There's no way. You cannot replace. It's going to help augment and allow us to be more at the bedside. And you'll hear in my talk and throughout the day. So the objectives today are how artificial intelligence is rapidly transforming healthcare and why its adoption matters more than ever now. Real-world examples of AI improving cardiovascular care. And you'll hear that both in nursing and in cardiac nursing, we're already doing this, including tools that enhance accuracy, efficiency, and patient safety. And how do we balance innovation with caution? We have to make sure that we have guardrails around it, and we do. We do at the Mount Sinai Health System when adopting it within our system. So the timeline of AI has evolved rapidly, really, compared to other technologies. I mean, for those of us who remember the electronic medical, in the 60s and 70s, paper charts were the dominant method, believe it or not, of record keeping, often stored in massive filing systems. In 1991, in fact, the Veterans Affairs implemented VISTA, was one of the first large-scale electronic health records. And then in 2014, over 75% of hospitals have adopted Epic. Artificial intelligence has only been, the boom has really been in about 10 years. In 2015, AI-powered assistants, right? We all loved Alexa, and we still do, and Google Assistant to gain mainstream use. AI in healthcare, we started using it in 2020, but radiology has been using it for years to be able to do the initial read. AI begins diagnosing disease and assists in medical imaging. And then in 2023, generative AI, there's an explosion. And you're going to hear, I mean, I don't know how many of you use ChatGPT or know about it, or Microsoft Copilot. All these aids are to help us, not replace us. The rapid adoption of AI, though, has led to opposing perceptions. It's polar differences. Either people are fearful, and I'll be very honest, probably about a year and a half ago, I was very skeptical that AI will displace my job, may be inaccurate, cybersecurity concerns, bias, and health equities. And then there are those that AI can solve everything, AI will enhance my job. It will enhance. It will. It'll make us more efficient so we can spend time. Why we went into nursing in particular is to take care of patients. This is the job that we're all in, is to take care of patients. AI will help to boost critical thinking, it'll improve in accuracy, and AI can reduce bias and promote equity. However, the reality of AI in nursing, why does this matter? Because honestly, all of us didn't go into nursing to document, to be data entry clerks. Research indicates that nurses spend an average of 33% of their time in direct patient interactions, only 33%. The remaining time is allotted to documenting and other administrative responsibilities. And we also have burnout, right? 60% report symptoms of burnout for both physicians and nurses and providers, but I'm talking on a nursing focus. And it costs the US healthcare system billions in turnover and reduced productivity. And also, we have a shortage of nurses for the next 10 years or so. So I think that we have to be creative and think of other models so that we can still deliver excellent quality care. In May, Nurses Week, for those of you who work here at the Mount Sinai Health System, we had the honor of having Tom Lowry, who is a former National Director for AI at Microsoft, and he's written several books. He was our guest speaker, and I'm going to quote him, that AI is not merely about technology, but it's about empowerment, restoring power to healthcare practitioners by freeing them from repetitive administrative tasks. The shift allows practitioners to focus on what truly matters, and that's patient care. It adds value in two ways. It helps to automate the work that we do, but it also, when I'm talking about it, augments. It allows us to be more efficient. I mean, it's helping us with our quality outcomes if we can get massive amounts of data versus having to spend days trying to do audits. If you can have that data in front of you, you can analyze it quickly, we can make the treatments, and we can be more efficient. AI is good at variance analysis, pattern recognition, for example, image analysis, like I said before. Humans are good at reasoning, judgment, abstract thinking, compassion, imagination, empathy, although I think that Sophia is also very empathetic, creativity, and problem solving. So, we want to go from data overload to actionable insight, and we want the data to flow to us, not from us. 80% of healthcare data is unstructured. It's notes. It's hard to use. We're spending hours in Epic trying to navigate and trying to find, particularly when we have, for those of us who have regulatory surveys, it's a lot of time in and out of the electronic medical record. And many times the data is hidden. It's in the notes. It's not where it's supposed. You've got to really data mine it. In real time, AI helps to organize and summarize massive data sets, like I said, instantly, and allow clinicians will receive and are receiving real-time alerts for deterioration. We're already using that to detect who is most likely to deteriorate, we're using it in patient experience, who's most likely to have a bad patient experience. We're using it, and I'll talk about it in a few minutes, in AI, in skin. We can actually treat and find out who's prone to developing skin breakdown so that we don't end up with a stage 3. We're notifying the WOCN earlier. We're already doing that in nursing. And also falls. Who's predicted to be at risk for falls? Again, prevention. So we're not paying on the tail end of a claim, of a lawsuit. We're protecting the patient. And also ambient tech. We're rolling that out, I know, here for our physicians, where it's ambient, where you can actually have your conversation with your patient dictated for you. In nursing, we're going to be rolling that out, I believe, the end of this quarter, which will help us. Again, we save time, 2 hours annually. It's able to flag what matters most, and we can be, again, more proactive and not reactive. This is my favorite, is #keyboard liberation. The weight of documentation has pulled us away from the bedside. We know that we didn't go into this profession to become data entry clerks. It's not here to replace us. It's here to restore us, to connect, to care, to heal. That's why we're in nursing, to give us back time, to make us more present with our patients, and gives us purpose. And again, to help us heal the system, and most importantly, return to what matters most, which is our patients. This is where Mount Sinai is leading the way in AI. We're actually doing this with a couple of our physicians here. They're able to predict highlighted patients who are in right ventricular failure. This, again, is being used currently here. We're also using it, we know that certainly sleep apnea is considered to be a modifiable risk factor for heart disease now. This is, Dr. Shah is actually using AI-powered models to link sleep apnea to heart disease. Again, instead of manually trying to comb through charts, this AI is helping us do that. Again, we're using it here in Fuster Heart. We're working with a company called Agile MD, and we have redone our heart failure pathway using this. It's AI, it actually sits on top of Epic. We're hoping to get this implemented. We had our Kaizen event March 13th and 14th. We brought leaders across the system to really update our clinical pathway using this. And now we have to enter it, and we're hoping to have that, like we said, first quarter 26. But it's already done and ready to be interactive. But that's, again, going to help us care for our heart failure patients, because we know that we get dinged on 30-day readmissions, right? We pay millions on readmission. This will help us be able to get large data. Again, like I said, we're leading the way, testing nurse ambient voice tools to enhance clinical documentation. That's something that we're rolling out, the end-of-shift summary report, particularly where do we put our new nurses when they start. They go to nights. It will give them a better handoff so that, we know we're very concerned about safety, so that, we make sure that we don't miss anything. So everything that you've done in your 12 hours will be grouped into a summary and a proper handoff. So that's going live again at the end of 24, like I said. We've already been doing this. A wound care nurse came to the AI team and said, can we use AI to predict a patient who's at risk for pressure injury? We spend about $5 million in our claims. That's not a good thing. We want to take that money and reinvest it, right? This is an algorithm that will actually tell you who's at high risk with these risk factors. This is telling the nurse, let's call a wound care nurse. So a wound care nurse can then go in and work with the team and start to do the interventions earlier. We're also doing it with falls. Same thing. Again, it's a predictive accuracy, and it will tell us these are the steps of what the nurses need to do to really try and prevent. And it facilitates timely intervention. We've been doing skin and falls, and I'm not sure that as nurses we've known that we've been doing this for well over a year and a half. Again, you're going to hear throughout the day, and you'll be hearing from Dr. Kinney about, Mount Sinai Fuster Heart Cath Lab and nursing. The collaboration of the cath lab nursing is leading the way in AI, introducing Sophia to assist. The nurses came, and I don't want to steal any thunder, but it's to help alleviate the burden. Do we want to do phone calls, or do we want to be at the bedside talking to the patient, getting the IV and getting the patient ready? So you're going to hear about this, and it's truly amazing. Again, we know everyone's afraid, but there's guardrails, there's a committee, there's, a team, but nursing needs to be on that committee, and we're really starting to place our nurses to work with our physician leaders to make sure that we maintain patient privacy, maintain data integrity, prevent algorithmic bias, preserve the really why we went into healthcare is that clinician and patient relationship. And we want to avoid over-reliance on this. I mean, clinical judgment still, trumps everything, but this is an assistance to help us. And again, the future of AI, like Tom says, in healthcare is not about replacing humans, it's about augmenting them. Responsible AI requires a commitment to transparency, governance, and human-centered design. And really, as AI continues to explode, nursing will be the most affected. And we need to make sure that we're at the table because it has to match our clinical workflows. Again, this is the Weinreich Department of Artificial Intelligence and Human Health. They're located on 102nd in Madison, and there's a whole building that's dedicated to AI, and I know that Dr. Kinney is working with a lot of them. It's patient-centered, clinically driven, safe, ethical, transparent, and it really works to help support clinical excellence. So in conclusion, the 3 takeaways: nursing must be at the table, guiding ethical AI development, workflow design, and patient advocacy. Nurses have to trust the why behind the AI decisions, and that we need to view AI as a clinical partner, one that listens, learns, and helps us lift the burden. Thank you.